Here now is Lisa Bell and Candace Campos with Florida Foodie.
Hello and welcome back to Florida Foodie. I'm your host, Candace Campos, along with our producer extraordinaire, Thomas Mates.
Hello.
And listen, food is vital to our everyday lives, and what we eat can have a big impact in our overall health. So a change in diet could also play a big role in overcoming a serious diagnosis like cancer, and cancer is such a scary word. So today's guest knows all about using food as medicine. She uses it as part of the HEAL program at Advent Health. So we are so happy to welcome today Dr. Amber Orman, who is a radiation oncologist with the Advent Health Cancer Institute. Welcome, and thank you so much for taking the time to talk to us.
Thank you so much for having me. It's really an honor to be here.
All right, so let's just start off, if anyone hasn't heard about it. What does HEAL, H-E-A-L, stand for?
So this is Healthy Eating, Active Lifestyle. Okay, and this is it's a program really to help cancer patients at any stage, from day one when they're diagnosed through, the end of their treatment and beyond. And it's designed to really help them tweak their lifestyle in a positive way so that we are reducing risk of recurrence, but also improving other things that might be going on. Maybe they're also suffering from diabetes and high blood pressure and high cholesterol, or they just don't have energy to get through the day. And so lifestyle medicine is my other specialty. So I'm a radiation oncologist, but I'm also a practitioner of lifestyle medicine, which is using food and movement, the way that you feel stress, the way that you sleep, your relationships, and your use of tobacco, alcohol, and drugs to really change your life in a positive way so that we are treating, preventing, and reversing chronic disease with the way that you're living, rather than relying wholly on pills and procedures and tests and things like this. And so it's true healthcare, as I like to call it. And so we're trying to cultivate health in a different way so that you take more charge of your life and you're empowered to really improve your own outcomes. And so that's really what the program is about. And the beautiful thing is that this is contagious, and that's usually a bad word. But, our patients will share it, of course, with their families that live within their own household, but also with their friends and their, distant family members. And so we find whole tribes of people kind of developing and changing their lives just as a result of us touching one patient.
I mean, and it's really funny, Doctor, that you say it's contagious, because our health reporter here at News 6 had an extensive conversation with you for one of her stories, and she could not stop talking about how powerful the conversation with you was, because there was so much information about not using technically medicine, but using food and a lifestyle to help yourself, to the point that she reached out to our producer and said, this could be a foodie podcast if you think about it. Yeah. So along with, the exercise and the lifestyle, let's focus on the food. I'm assuming it's all plant-based, or, what's kind of the general idea of what food works?
Correct. So when we look at the data in the world of nutrition, okay, we can argue just about anything. And so you can, say, okay, well, keto is better for this, or, high carb is better for this, or yada, yada, yada. But you have to kind of look at the totality of the data when we're discussing nutrition and really look at what are you comparing to what. And so if I compare the standard American diet, okay, which is heavy in processed foods and lots of, sugar and fat and starch, and very devoid in plant-based foods, truly whole food, plant-based items, to something just a little bit better. It doesn't have to be an amazing diet. Maybe we've just removed processed food, but you're still eating lots of meats and lots of sugar, and other foods. That'll still look better than the standard American diet, okay? And so you have to keep in mind, what are we comparing here? And so when you look at all of the data related together. A plant-based diet, a plant predominant diet that doesn't have to be 100% or vegan or whatever term you want to use, but simply a diet that is mostly plants, okay, is the healthiest way to eat. I can say that with, complete confidence. And so why are plants so healthy? Well, one of the biggest positive properties of plants is that they contain fiber. And so fiber is not in animal products. We have to keep that in mind. So fiber is only in plants. And the reason that a steak is tough is not because it's full of fiber, okay? And so when we're eating fiber, that is what our gut microbiome needs to be happy. Now, what is our gut microbiome? That's a population of bacteria in your gut that is absolutely central to many processes in your body, okay? And we're going to talk about the immune system. And so when this population of organisms in your gut is happy because they've been eating a lot of fiber, the global level of inflammation in your body is lower, and your immune system is functioning in a better way. And when our immune system is functioning in a better way, it can pick off little cancer cells that are floating around in our body from time to time, because that is the case. We always have, a cancer cell or two roaming around, but our body is designed to take those out so that it doesn't land in breast tissue or the pancreas and grow to become a tumor that we find and diagnose and treat. And so that's one of the main ways that, plant-based foods benefit us in terms of preventing disease is via the gut microbiome. So more plants, happy gut microbiome, healthy immune system, less inflammation, okay, equals less cancer, but it also equals less chronic disease. And so when I say chronic disease, I'm talking about heart disease, diabetes, stroke, Alzheimer's, all of these things that are really seen almost as obligatory diseases of aging, right, are largely preventable, okay? Now, when we talk about breast cancer specifically, which is kind of my world, 5 to 10% of it is truly genetic, okay? The rest, it's up to us. And even if you have a genetic predisposition, that's modifiable with your lifestyle. And so we're kind of, encouraging our patients not to go drastic change. Okay, that's not sustainable. You have to do it in a way that's sustainable for you, because this is not a diet, this is a lifestyle. And so gradually over time, crowding out the animal products, the processed foods, everything but the plants, so that your plate is, half vegetables, a quarter fruits, a quarter, beans, grains, nuts, and seeds. That's kind of the goal.
Changing your life one vegetable at a time. Florida Foodie will be back with Advent Health Oncologist Dr. Amber Orman to explore the science behind the food we eat and simple ways we can make better choices in the grocery store.
Read the ingredients. And if you recognize all of the words in that list, you can think, oh, I know what a cucumber is. I know what zucchini is. Okay, and it's got some spices. All right, check. That's like a real food.
More Florida Foodie in a moment. We're back with Florida Foodie, and today we're diving deep into the science behind plant-based diets. How adding more veggies to your plate can get results for treating and preventing chronic disease.
So you talked about anti-inflammatory foods, and I know there's a lot of supplements out there, like people take turmeric pills and things like that to try and have that same effect. But does that actually do anything for people? Is it more important just to have that part of your normal diet as opposed to trying to just be a supplemental intake that you take to counteract all the bad stuff you normally intake?
Yeah, so if you just think about it on a very basic level, how could we expect our body to treat an orange or a strawberry, which are very good sources of vitamin C, in the same way as it would a tablet of stuff that came out of a lab that doesn't have the accompanying fiber? And so when we think about true health, we want to consume food in its whole form. So rather than drinking even orange juice, we're eating the whole orange, and apple pie is not a great source of apples, but an apple is,
But maybe on Thanksgiving.
Things like that, And so, yeah, you got to allow yourself the indulgences. You can't, if you're too strict we know what happens as humans. We revolt against that and kind of go back to our old ways. But finding a place that works for you so that you're feeling the benefit, but you have room for the occasional indulgence is the perfect place to be.
I come from a Hispanic background. So when I cook something for my family, if I make them a pasta dish with mushrooms and peppers and stuff, the first thing that my family asks me is, where's the meat? Where's the protein?
The problems with meat, okay, that is our major source of saturated fat, okay, animal products. Okay, now there's coconut oil and palm oil. They're a source of saturated fat in a plant. But by and large, our saturated fat comes from animal products. Okay. Cholesterol comes from animal products. That's also our only source of dietary cholesterol. And so we also don't need to eat large amounts of cholesterol, okay? And so these things lead to heart disease. When you have high fat intake, okay, that's not good for your body. Heart disease, diabetes, these are all consequences of that. And when the cholesterol is very high, okay, this elevates your LDL, okay, and that gets oxidized and that turns into cardiovascular disease, okay? We produce enough cholesterol in our bodies on our own. We don't need to be eating it, okay? Animal products, remember what we said, no fiber. And so they have a detrimental effect on the gut microbiome because you're not providing the fiber that those gut bugs need. And so you're actually cultivating bugs that are more pathogenic rather than beneficial. Meat is actually our top contributor to antibiotic resistance, which a lot of people don't know. So 70 to 80% of the antibiotics that we use in this country actually go to livestock. And then we eat them and we're getting exposed to the antibiotics and any of the bugs that didn't get killed by the antibiotics, which are the resistant bugs.
What?
And so, yes, fascinating. If you've never looked into this, read into this a little more.
That's a rabbit hole I don't know if I can handle.
Yeah. You'll call me in a couple weeks.
Oh, goodness.
But yeah, it's so true. And people don't realize, how much of a crisis this really is, because modern medicine is so different and so wonderful largely because of antibiotics. Infection used to be one of the top causes of disease, and then we brought in antibiotics and all of our hygiene, and this has benefited us quite a bit. But if we use all of our antibiotics on our livestock, or the majority, and then we're constantly being exposed to low-level antibiotics, okay, then those antibiotics may not work when we actually need them when we get an infection.
Okay, it just clicked for me.
Antibiotics also
That's when they say
gut.
no antibiotics on the packaging. Mm-hmm. That's how that impacts us.
Yes,
that's
why they say it.
So let's go back to cancer patients. I mean, what are the benefits for cancer patients? Have you seen almost miracles happen in front of you with a change of lifestyle like that?
Yeah, so one of the big risk factors for getting a breast cancer or a breast cancer recurrence is being overweight. And so when we are taking a breast cancer patient and shifting their diet to include more plants than anything else, again, you don't have to crowd out all the animal products. If you still need your meat, you can eat it, just have it as a side dish, okay? But when we're doing that, we're shifting your gut microbiome, and suddenly, oh my gosh, the weight is coming off. And so we see this all the time. We'll have patients lose, 10, 20, 30, 40, 50 pounds. We've had patients get off of all of their medications, their pill for their high blood pressure and their pill for their diabetes and the pill for the cholesterol, like literally get off all of the things that they were on. The other cool thing that eating plants does is your gut makes most of your serotonin, which is the feel-good hormone, the happy hormone. It's actually made in your gut. And so when your gut is in a better situation, when your gut microbiome is happier, you make more serotonin. And so eating more plants can actually help with depression and anxiety. And so we underestimate the power of what's at the end of our fork. And it is truly the most important decision that we make every day, multiple times a day. okay? And the way that we make our decisions is also very complex, and our emotional health has a lot to do with how we behave and what we put into our mouth. And so we can't divorce all of the other aspects of lifestyle medicine from the food. The food is certainly foundational and important.
So, doctor, I just want to ask you one more question from my side. If there is one thing, if there's our listeners, our viewers are paying attention to, what would be the first step? What would be the first baby step that you would like our viewers or listeners to do?
I would say if you're looking to change your life, ask yourself first, why? Why do I want to change? And write that down and have that central all of the time. Post that on your mirror, put that wherever you need to be reminded, okay, this is why I'm doing this. And I'd say if you're wanting to change the way that you eat after you've defined your why and your goal, simply start by eating more plants. It doesn't have to be complicated. You don't need to be eating, to be starting your day with celery juice and, cayenne and apple cider vinegar and molasses and, just start eating more plants and eat them as close to their original form as possible. And so, like if we're talking about oats, for example, choose steel cut oats rather than the little packet with all of the sweet, chewy things in it, so you want to get close to the original oat. So when we say whole food plant-based, that's like the gold standard, okay? You're eating mostly fruits and vegetables, beans, grains, nuts, and seeds. And it doesn't mean you're not cooking and combining things, and it doesn't mean you can't buy anything in a package, but read the ingredients. And if you recognize all of the words in that list, you can think, oh, I know what a cucumber is. I know what zucchini is. Okay, and it's got some spices. All right, check. That's like a real food. Mm-hmm. But if it's got some chemically looking names in it and the expiration date is a couple years from now, then you don't need that inside of your body. That's not real human food.
Gotcha. And so one last question would be, if people are interested in the HEAL program, maybe they don't even have a cancer diagnosis yet, but they feel it might be a concern for them. Where can they participate, one, and two, where can they find out more? Where can they sign up?
We are serving patients in Florida, okay, and you would just need to make sure that I'm covered by your insurance, or my co-founder, Dr. Mackenzie, if you're a gynecologic cancer patient, okay, you would go to her HEAL program, and you sign up on the Advent Health Cancer Institute webpage. And so I believe it's adventhealthcancerinstitute.com/healbreast. You could also just call my office. I practice in Celebration, Florida, at the Advent Health Celebration campus primarily. And you can always call there and we can get you enrolled in the program. Now, we do have a quarterly free, open to the public program where we just meet for an hour and talk about a more general topic, not necessarily breast cancer. And so those are announced also on the Advent Health Cancer Institute webpage. And so those are the places where you can sign up.
Well, I mean, Dr. Orman, thank you so much for taking the time to talk to us and just inspire us a little bit, inspire us to be just a little better and listen to our bodies, which is sometimes we don't stop and take the time to listen to it. So thank you for that.
Thank you so much for having me and for, giving this information a platform. I think that it's hugely important and very timely because we're in quite a mental health crisis right now. And I think a lot of us are looking for positive change and inspiration. And one way that you can truly do that is by changing the way you eat, because as you change the way you eat, you feel better, and you change the way that you move, and then your sleep improves and you are functioning in a better way throughout your day, and your relationships improve. And so it has this beautiful positive upward spiral effect. And I wish that each of you find that.
Thank you, Doctor.
Thank you so much.
And thank you for watching Florida Foodie. If this episode inspired you, or if you're more interested in burgers and fries, check out our other episodes of Florida Foodie, like the story behind Orlando's only barbecue donut shop. stream anytime you want on the new 6 Plus app.